All right, so our next classification here. Note I've colored our referred radiating lower extremity pain red, and our other radiating, or our stages of radiating pain in a shade of orange. Red because it's closely related here, but not quite orange, right? So with this, we're talking about folks that traditionally might be thought of as having a disc issue with radicular pain. So that being said, um, being a traditional thought here, just remember that folks can have radicular pain for different reasons. There can be different health conditions or different problems in the lumbar spine that result in radicular pain. Now, that being said, these are the folks that are going to centralize or peripheralize with repeated motions. So repeated flexion or extension or lateral flexion in one direction or rotation. And I'd say generally, the vast majority of the time, I'll gear more towards flexion or extension. But I have come across the occasional patient where really lateral flexion or rotation was a centralizing or peripheralizing factor, much more so than just flexion or extension. And we're talking about a observation or common observations here that we might see that reduced lumbar lordosis. So either trying to relieve symptoms by being in a more flexed position in the lumbar spine, or potentially a postural change or a postural abnormality that we're seeing with these folks. Lateral shift, common as well. So again, trying to shift away from a painful side or potentially a compensation that we have related to this health condition or another. And with this, our primary intervention strategies, we can think about exercises and really focusing on those exercises that facilitate motion in the direction that causes centralization of symptoms. So if the patient tends to have pain centralized with repeated flexion, coming towards exercises that have the patient doing repeated flexion. Active range of motion exercises. For example, having the patient in quadruped and having them arch up like the angry cat. So flex the lumbar spine and arch up in repetition. Now, and then return back to neutral. Also, patient education can be really key. So if we notice prolonged positioning or repeated positioning during functional activities, or based on the functional activity limitation, if the patient is likely to be going through repeated motions in a certain direction, really educating the patient to avoid that repetition or avoid prolonged positioning in those positions that are going to make matters worse. And when we're talking about our subacute and chronic low back pain, commonly folks might start off in our referred related radiating pain and might be more likely to progress on towards that movement coordination impairment that we find, as we talked about with the last classification there.